you know who you are and what you want? Wow. So I know who I am.
I've had multiple attempts to have parts of our existence canceled. During COVID, we had threats to our family.
My guest today is Dr. Kwadwo Kyeremanteng. During the deadliest global health crisis in over 100 years, one that hospitalized millions, he saw what medicine looks like when there are no right answers. Medicine is often sold as a calling, but no one tells you what happens when that calling puts you in an ICU during a global pandemic, making decisions that will follow you for the rest of your life. That's the cost of leadership. Dr. K, how are you?
Excellent. Thanks for having me on the show, bud.
No, it's a pleasure to
really appreciate
for
this.
you to have you on. How are things?
Honestly, awesome. We're in the holiday season. We are feeling good. I know there's a lot of cold and flu going around, but our house has gone through the worst of it so far. So I feel like we're on the better half of that. So feeling good.
Have you seen an uptick in flu cases?
Yeah,
ICUs?
definitely. Yeah, definitely an uptick in flu cases. We aren't seeing flu to the point where they're needing to be on a ton on ventilators or life support, but just people coming in sick. Mm-hmm. But it's par for the course. We'll be all right.
Okay. Yeah, no, it's actually funny. The other day, when I was talking to my sister and I was telling her who we're having on the podcast, I told her who you are, and she was like, "Oh, no way." By the way, she's a nursing student at Nipissing University, and she's like, "Oh, no way." In my lecture last week, my prof was showing a video featuring you, talking about your mantra, prevention over prescription. So, it's really cool that we're having you on.
Small world. Tell your sister I say hi. That's amazing. I didn't realize that we were getting a little bit of love in some of the nursing schools. That means a lot.
Yeah, no, your reach is definitely not condensed to Ottawa. It's definitely extending outwards around Ontario and Canada.
Oh, appreciate that.
So before we jump into things, please share with our audience who you are, what you do, and why.
All right. So who I am a ICU. I run the ICU at the Ottawa Hospital. I also have a background in palliative care, did a master's in health administration, just because I saw a lot of inefficiency in the healthcare system and I wanted to be able to try and do something about it. Mm-hmm. And ultimately, we formed a research group. We called ourselves Resource Optimization Network, really looked at ways that we could make our dollar go further in healthcare. And unfortunately, nothing was changing. Yeah. And we're close to publishing close to 100 papers in academic journals. And our team came to the realization we got to do more. It can't just be about publications. Mm-hmm. It's got to be, how do you get the word out? And so then we pivoted a bit to being more vocal on using a podcast format, using social media, and then eventually a little bit of mainstream media. And
that's interesting, actually, because usually the world of academia, it's very rigid, it's very traditional. And I think you guys are really extending and reaching the younger audience as well.
Absolutely, because you want to look at what is going to create impact. And I think that's not the question. We're not often asking ourselves that question. What is going to impact lives? How are we going to reach people that need us the most? And one of the realizations that I came to was that when you saw people land in ICU, it really came to this realization during the pandemic where people were coming in with, unfortunately, a preventable disease, in the sense that they had type 2 diabetes, metabolic syndrome, obesity, high blood pressure. And a lot of those folks, if we modified their lifestyle, we could have avoided them from getting this sick. And that was during the pandemic. Then we also saw ties to metabolic health with mental health, cancer, cardiovascular disease, strokes, infections in general, fertility. So then we really pivoted and with that lens of, let's focus on prevention. Let's avoid landing in ICU or in the hospital in the first place. And you're going to save millions. Yeah. You're going to avoid the suffering of landing in ICU. Like when you see the people come into my unit or our unit, you are don't come out the same person. You have mental health issues, unfortunately, whether it's PTSD, depression, anxiety, the impact it has on your family, the impact it has on like the economics of your family too is dramatic. So if we give people the tools and focus on prevention, man, like it's so powerful. So this is why I get really excited about that stuff. That's why we wrote a book on this stuff.
Yeah.
And we're gonna start leading the charge on why this is important.
No, I think it's really great that you're advocating for this, because I find with a lot of people I know, they don't make a real tangible change until something really bad happens, and it's unfortunate. And I'm really glad you're preaching this. So talk a little bit about your background. Where are you from? Talk a little bit about your family.
Yeah, thanks for that. I love giving a bit of history there, because I grew up in Edmonton, Alberta.
What,
And
Oilers fan?
Oh, big time Oilers fan.
Oh, well, I don't think we can be friends anymore.
What's your team?
Sens.
I mean, Sens is my
Local
number
guy.
2. Yeah, I'll give Sens is number 2, but it's like Oilers and then it's like Sens.
Okay.
Shout out to McDavid and crew and Tristan, the new goalie for our Oilers. But yeah, I grew up there. Always knew I wanted to be a doc. Like at a very young age, I had really bad childhood asthma, and my pediatrician was my hero. And the way he would create this calming impact when you come into hospital, can't breathe, mom's anxious, and he would just put his hand on your chest, and you knew everything was going to be all right. So I wanted to be able to create that for folks, like really alleviate suffering. And then, yeah, I grew up there. I'm one of 4 kids. Parents are from Ghana. Now raising 3 boys. Big hockey family, big sports family.
Yeah.
We were just talking beforehand. You playing for the Cyclones. My eldest plays for Junior 67, so a bit of a rivalry there. But yeah, big part of our lives is being very active. Like, so sports is a big part of our lives. Working out's a big part of our lives. Eating well, thinking about how we fuel our bodies. But yeah, it's a fun household. You come to the Kyeremanteng house, usually their friends are over in the summertime. The pool's open and kids are doing their thing.
I can really see that in your personality. You seem like a very fun, upbeat guy. I listen to your podcast too. Yeah, no. So you mentioned your great experience with your pediatrician and how that kind of inspired you. Was that where the first initial idea of medicine popped into your head, or was there another moment that sort of paved the way for that path you wanted to go down?
Oh man, that's a good question. It really was the pediatrician, because I unfortunately was probably hospitalized 2 or 3 times a year as of the age of, we'll say, 4-ish. And so I spent a lot of time in hospital, and you could imagine as being a 4 or 5-year-old, you're scared, and you're not sure what what that admission is going to bring. And just to know that someone like Dr. Conradi could bring so much peace in a stormy situation, I really felt that it was important for me to, for me, this is how I want to contribute to the world. And then did undergrad, always thought I would do something in medicine, but then lost my way for a couple of years, did a minor in economics, and thought maybe I'd do something entrepreneurial.
Why did you pivot?
I don't know, actually. Maybe it was just I saw how competitive it was. Maybe wasn't sure if I had enough, I had that ability to compete with some of the other folks, and eventually got,
What were some people telling you?
Well, it was just more that I was seeing the marks that they were representing and hearing the marks that you would need to get into medical school, and I was a very average student.
Yeah,
I always just barely getting into what I was hoping to get into, and so then I thought maybe this is aiming too high, and then I got a little bit of more exposure to medicine. One of my friends, I got to shadow their dad in the OR and then in clinic, and I'm like, yeah, this is for me. I'm supposed to do this. And so then I put in the extra effort to try and get in. Took a couple of years after undergrad, but which I highly recommend, by the way. The gap year stuff was unreal.
What did you do throughout the gap year?
Oh man, I traveled a ton, and I had the best job you could imagine for a youngin. I was a bartender for
Oh man,
throughout the different bars.
those must have been a fun few years.
Oh my god, it's how I met my wife actually. Yeah,
Oh, no way.
So it was. I look back at those times, and you have a lot of highlights in your life,
Yeah.
but that was clear highlight. Those 2 years of working 3 days a week, the social aspect.
And traveling the world, like seeing different countries, like seeing different traditions, customs, like those are invaluable experience. And like I find too, so I'm in health sciences, and in the pre-med culture, I find it's a big rush to get to medical school. For our audience of pre-meds watching, like, they're like, I got to graduate 4 years, I got to write the MCAT, summer of third year, and then I got to get in bed at this time. Like, tell the audience why, like, everyone has their own path, their own unique path, and to not get down on yourself if, like, your path isn't linear. It's not like most people.
Yeah, I couldn't agree more, because there's a reason why in some ways, there's a reason your path is written the way it is, and there's so much valuable nuggets from a bit of a circular one. Like I could promise you, as an example, the amount of lessons I learned as a bartender has made me a way better physician.
Yeah.
Like I could read people, I know how to multitask, I could sense when trouble is coming. You just get all these kind of life skills from living. Same from traveling. When you're in circumstances where you're not sure where the next place you're going to stay is, using that practical skills to try and figure things out, and like there's just so many nuggets you could get from living your life. And maybe your path is that you get in after 4 years and do your thing, but just realize also that there really isn't a rush. Like once you start on the path to medicine, you'll have some breaks during first and second year. Those summers are pretty good, where you get to be adventurous, but you're pretty much staple to doing like something related to medicine the rest of your life, right?
What were some of those translatable skills that you learned from bartending that you incorporated into your practice at the ICU?
Oh, yeah, multitasking. I think reading people, for sure. You could sense when a team member or a nurse is struggling with something, or there's more to a story. What are the life lessons you get? Like handling stress, because
I can just imagine.
It doesn't seem like it's a stressful job, but when the well is 3 deep, and then you got your servers that also have a bunch of chits that are ready to go, and so you gotta deal with them. You gotta deal with some fussy people waiting for their drinks. Then all of a sudden the kegs are out. Like all these kind of things that in the moment feel like very stressful, but you learn how to navigate that and to prioritize and to delegate, and so to really to figure out ways to work as a team. And so to me, I learned so many nuggets bartending. Just the value of treating people well, the value of being an effective communicator. It was, in hindsight, it was some of the best days I have had. Period.
And like while you were off, like for those 3 years between
2
undergrad, 2 years between undergrad and medical school, like what was your family telling you? Were they putting any pressure on you? Because I know you come from a family of pretty high achievers. I mean, your siblings are both dentists.
Yeah. There was there was a lot of pressure from the family. Ethnic parents, they tend to do that too. But I don't know. I did feel a lot of pressure to get it done, but there was this voice inside saying like it's gonna work out. Like we're gonna figure this out.
Trusted your gut.
Trusted my gut, and I and honestly, I wouldn't have had it any other way. I wouldn't have had it any other way because it was that second year when I met my wife, as an example. If we got in to
Blessing
med
in
school,
disguise.
we probably wouldn't have met. Like it was just a ton of goodness happened around that time, and like I said, I wouldn't change a thing.
Live life with no regrets.
Yeah, absolutely. I mean, it's a good lesson for the. I know it's hard to hear as a youngin coming through, but you got so much time. There's no rush, and there's something to be said about just figuring stuff out, taking that time. You're gonna meet amazing people. You'll become a better clinician or whatever you choose in your career path. You'll become better because you have that life experience. Like one of the things I'll say, sometimes like in my medical school, we had the youngest person.
Where did
was
you go
17.
to medical school, by the way?
U of A.
U of A?
Yeah.
Okay.
The youngest person was 17 at the time. Yeah, turned 17. Like she was late birthday. She was turning 18. Skipped 2 grades. Got in after 2 years, and she was an exception in the sense that she, despite not having much life experience, she was very grounded, down to earth, very
101.
yeah, very good clinician. But a lot of people in similar circumstances, because of that lack of life experience, they just weren't as in tune. They had a lot to learn. So, you know, there is an advantage of having taking a bit of time.
Yeah. So let's transition to the time around when, COVID-19, the pandemic ultimately haunted our world, especially in Ottawa. I know you definitely became a prominent figure during that time. So, Dr. K, like, while you were working in the ICU when the world was shut down during the pandemic, what was that experience like, and what really stood out to you during that time?
Yeah, it's a good question. It was, I think I would describe it as a very, at least initially, a very scary time because we didn't know what we were walking into. We didn't know if we were going to be similar to New York or Italy and be overwhelmed. We didn't know if we were going to get sick ourselves. We didn't know if we were going to bring COVID to our families. But what really stood out was like we all just stepped up. You know, it was values over fears. We knew our patients needed us. We knew our community needed us, and despite putting ourselves at risk, there was no hesitation that we wouldn't be there for our patients. And so that purpose was majestic. Like this sounds crazy, but in those early days, I was looking forward to go to work.
Really?
Yeah, because like we were doing some powerful stuff.
You weren't worried or scared at all about attracting COVID or like potentially bring it home? Like,
to be honest with you, after about 2 or 3 weeks of seeing the typical patient, then we start to realize like if you're young and healthy, you had nothing to worry about.
okay.
And so that to me was one of the reasons why I could sleep easy at night.
Yeah.
Knowing that I didn't feel like my immediate family was at risk of dying from this condition. So then that just allowed us to even be more confident and more present for the patients that needed us. And it was, to me, that part was special. I'll never forget it. Like when you feel like you have a purpose, it fuels you, it energizes you, and it really, I just saw some beautiful moments amongst our healthcare providers. Like I've never felt so close to our nurses, to our docs, when I saw us rally and be there for our patients despite the fear.
No, that's amazing. And I think our healthcare system, especially in Canada, we performed very well during that time. Is there a particular story or moment or patient interaction that really stuck with you and you'll never forget?
Yeah, during the pandemic, it was in the early days where we had this young guy-ish in his 40s that got really sick in that first wave from his COVID infection. One of the first that I saw get this sick.
Okay.
And he declined so quickly and so severely that he needed the most amount of oxygen that we could provide. His kidneys started to fail.
Oh, wow.
So in the moment when we, once again, early days, so we were all scared, but we were all there present trying to support him. We had to put a catheter in his neck to try and do dialysis. So any slip of the hand would have been terminal, unfortunately, for him. We had to get him to a CT scanner, which moving him in and of itself was at risk. We had to flip him on his stomach, called proning, to try and optimize his lungs. And all of us, despite the hours, were dedicated. You know, nurses went overtime. Our respiratory therapists went overtime to just see him through that tough period. And he eventually started to improve and got to the point where he's home and survived. But it was just a beautiful moment where, despite the fear, despite people feeling like their shift's done, but they wanted to see him, they wanted to help him through this window, and it was just a moment where.
Did he end up surviving?
Yeah, he ended up surviving.
Oh, okay.
Yeah, and just once again, all of us feeling that purpose and that the value of trying to be there for our patient, and I'm certainly glad that he survived and
is
made it through.
Is it moments or situations like that which you remember and drives you to this day?
Yeah, certainly the stories like that where we go above and beyond, and sometimes sometimes you see patients that you don't think is going to do well, and then you somehow manage to get them to rally and get them through their illness. Those stories you never forget. But then you also never forget the awful ones, like the sad, tragic young people dying, unexpected deaths. Like those ones that really unfortunately stick with you, and it's part of the job. But it's hard when, especially when you can relate to them. If you young moms, I always have a soft spot for you when we lose young moms.
And how do you cope with seeing that? Like, it's not easy, right?
Yeah. No, it's one thing I'll say is like this job's not for everybody. Like you got to be able to compartmentalize to a certain degree, because like say you have something tragic happen, and then a few minutes later or an hour later, now you got to deal with somebody that's bleeding to death, and so I need to be fully present to try and resuscitate that patient and get them through that part of their illness. So you have to have a certain level where you're able to compartmentalize, but then I always say you got to process it somehow. Like whether you're sitting down with your partner saying that was a tough day, or a colleague saying, "Wow, that was a tough one," and let it digest. Talk it over with your colleague and friend, but yeah, you can't just squish it down. Otherwise, it kind of shows up in ways that
do they teach you in your training how to like deal with situations like that or process situations like that?
That's a good question. To be honest, I'm not. I feel like maybe there was a bit of that, but it doesn't come to mind right away there. But once again, I think you're drawn to a job that you can handle, and like I'll see, like I start back in the ICU on Thursday. My expectation is usually you see someone die almost daily, you know what I mean? And one of the parts of that is that a lot of the time the deaths are expected, and the way I value it is like I'm there to make the experience the least painful as possible, and that could be through effective communication. It could be through making sure the patient's not suffering, but I feel that aspect of my job is just as important as anything else. So that's why, I mean, if it's clear a patient's going to die, regardless of what you do, it's important for me and my team that we alleviate suffering, that we
Yeah.
don't make it any harder than it has to be.
And that kind of like leads into my next question. Like over the years working, like having gone through the pandemic, has the way you think about your responsibility as a physician, has that changed at all?
That's a good question. I personally look at myself differently. I don't know if I look at the role of physicians differently in general, but I put more ownership on myself to be like a true leader. Like I wrote a book called Unapologetic Leadership because I thought like your generation and plus needs a roadmap for leadership, a guidance for leadership, because I felt like during the pandemic we were doing too much fear-based decision making. It wasn't from a place of values and so I view myself now as I have the responsibility to not sit on the sidelines. Like when you have a audience, when you have a following, when you can really create some good, why not leverage that to create some awesomeness in the world?
Yeah.
Like, I mean, if you follow our content, it's not about, hey, look at me, we're awesome. It's more, hey, you can get fit, you can eat well, you could reduce your stress. Let's give you the agency to have the tools so that you feel the best form of yourself. And I gotta say that it's been so rewarding.
Yeah.
It's been when you get like a mom or a sibling that calls you up and say, oh my sibling's no longer on diabetic meds because of your messaging. Like that's awesome. You've just really changed the trajectory of that patient's life and their family around them.
Yeah.
So yeah, I do see my role has changed over the years.
Yeah, no, like you wear a ton of different titles. I mean, you're a physician, you're a researcher, entrepreneur, author, public speaker, podcast host. Is there anything I missed?
Yeah, I think you nailed it.
But yeah, no, like I love all the things you're doing outside of your day job, right? As an ICU doc. But, with all these things that you're doing, what is the deeper rooted issue in people's lives that you're trying to address, like using all these different platforms that you have?
Yeah, I'm trying to ultimately, like at a highest level is to reduce suffering, but at a more basic level, it's how do we give people the tools to take care of themselves? How do we get through all the noise? You go on your IG feed, someone's telling you to dip your head under water, cold plunge for 53 minutes or whatever the hell under infrared light. Like it's garbage, and so like I think you often don't get sound, simple advice that actually can move the needle in your life. And so to me, at the highest level is reducing suffering, making sure that people feel like they have the agency to take care of themselves. And that, I think that's been my like North Star. And even more simply is like, how do you avoid people landing in ICU? And just because I'm approaching 20 years of clinical experience.
Wow.
And when you see people go through an ICU admission, it's not good. And so I don't want to see more people land there that don't have to. Like there's always going to be the car accidents, the unexpected strokes and head bleeds and aneurysms, but let's not add to it. Like let's not add to it. You're a smoker. Let's pivot. Let's give you tools to avoid those cravings so that you're not getting that lung cancer or that lung infection and so forth. You're 40 pounds overweight. Let's talk about the steps we can make today to help you get to where you need to be. And I also think we could do this. Like I actually think if we focus a little bit more on these things, we could get us in a healthier state. I have no doubt about that. And so hopefully the future is brighter than it is now.
Yeah, no, 100%. And like above all these titles we talked about, you also hold the one that matters most, and that's dad, right? When you think about the impact that you're trying to make through your work, what lessons or values do you hope your kids internalize from watching you go about your craft day in and day out?
What a great question. I got a little soft spot for this because it's like one of the biggest drivers is to inspire your kids to greatness. And I think for me, it's important to model these things as opposed to just say them. And I think if at the end of the day they could see the value of working hard and hustling, if they could see the value of supporting other people and like sticking up for those that can't stick up for themselves, doing the right thing. If they could leave, if I could leave them as young adults that have that value, doing the right thing, justice, sticking up for those that can't stick up for themselves, I'd be a proud dad. I think we've tried our best to do it through modeling. Like one of the proudest moments I can think of is my second born. We started a charity like at the beginning of the pandemic to support our youth.
What's the charity called for the audience that's not
It's
aware?
Bridges Over Barriers.
Bridges Over Barriers. Okay. If anyone wants to check that out.
Yeah, thank you. And the middle kid, I was going to an event.
Yeah.
For I don't think it was a Bridges. It was a separate charitable event anyway. And as I'm leaving, he runs down to his piggy bank, gives me like a $5, and he's
How
like,
old is he?
At the time he was 7, maybe.
7-year-old.
Yeah.
Wow.
And he's like, yeah, this is. Oh, I get emotional. Think about it. He's like, yeah, I want to help. And no cues, no nothing, just.
Wow.
Yeah, a little.
7-year-old too. Like at that age, like $5 goes.
Oh yeah. Like,
goes a long way.
like it was real money to him, and he's willing to help out because he knows there was some kids in need, and that's how I know we're on the right path with our kids. We still got work to do, especially having a teenage son, but yeah, that's exemplifies what we're trying to do.
What's something you always tell your kids? What's something you always preach to them?
It's probably what they'll say is like, "Are you allowed to?" I was like, "Don't be a tool. Like don't be an a-hole. Like be nice. Like you know what I mean?
Good
like,
person.
Yeah, be nice." I often say that to them. What else would they say? Yeah, I mean, I'm a pretty, like we joke around a lot in the house, but I'm a pretty, out of mom and dad, I'm the disciplinary one. Like I'm hard on the boys. More hard on the boys.
Which is surprising because you seem a very like a happy, like upbeat, relaxed guy. So that's interesting.
Yeah, I mean that's the baseline. Like we'll have fun. We'll joke around. We like, for example, on a car ride, or if we're bored in the house, we like to play this game called Last One Laughing. Okay. So all of us just try and make each other laugh. So they'll make a funny face, or they'll do something silly, or talk in a weird accent. But if they, if they're not getting to bed on time, or they're not doing their homework, I'm like, those screens are off, and they'll be off for a while if you're not getting upstairs doing your homework. Like that's my style. Like fun until you push the button, like you go past the threshold, then then different dad shows up.
Do you think any of them will fall in your direction? Like, do they like science, studying the human body? Like, oh,
that's a good question. Actually, so far no one's clearly throwing down the medicine vibe. No one's clearly throwing that down. Yeah. But if I had to guess which one, it would probably be my eldest. Okay. Just because he seems to following dad's footsteps to a certain degree, but no one is screaming medicine.
Yeah.
And which I'm totally fine with.
It's a long journey. It's a long, hard journey.
It's actually not only that, it's not easy. Like it's not all unicorns and bubblegum, if that's an expression. I just made that up. But there's good parts, but there's some really challenging parts, and in the landscape, not to get too off topic, but the landscape of medicine, I think, is going to change quite a bit in the AI era. Like there's going to be some jobs that are going to become less valued.
Do you think the role of the physician changes?
100%.
In what ways?
Oh, there's so many ways. So like your patients are going to come to you with the diagnosis. Everyone's going to know what's wrong with them. Like there's some AI platforms that are already like amazing.
Something a lot with triage too.
Everything. Like literally everything. Like there's stuff that I think we could be using now, like triaging, deciding who needs surgery. Like I think that could be primarily done through AI, but overseen by a human.
Yeah.
Because if you look at what's going on in the region, you try and find somebody to do your hip or some kind of ortho procedure. You go on some random doc's list, but realizing someone else should be a priority because they're, I don't know, more injured or a different degree. So AI could find that doc, find what's the optimal timing, all that kind of thing.
Okay, so it's funny you say that because Dr. K, I got a little bone to pick with you.
Yeah, let's hear it.
So I know you work in ICU and not the ER, but so summertime, right? My girlfriend has a concussion, and I'm going to the ER, and we wait 20 hours to get seen by a physician. Especially with all the AI tools we have now, like why are wait times in the ER so long?
Yeah, that's a big one. That's a big question. Lack of primary care, lack of movement in the hospital, a lot of people waiting placement. I do think there are solutions out there that we could leverage so that wait times are less. Like I do think we could be leveraging like virtual urgent care. Like if you don't feel like the patient's going to be needing to be admitted to hospital, maybe they don't need to go to a tertiary or quaternary center for care. So, having those centers outside of the walls of the major hospitals for sure. But, I mean, imagine you could go on a virtual platform, we'll call it virtual urgent care, and you have the concussion and you talk to a doc virtually or a nurse practitioner or somebody that we feel is capable of doing the assessment and saying, okay, based on these symptoms, I would say you're okay not to get a scan. Here's what you got to look out for. Here are the flags. If anything changes, show up at the Civic or General or wherever.
Yeah.
That would have saved you 19 hours.
Yeah.
And it wouldn't take the clinician that long to do. And a lot of people would be willing to do that job. So I think there are answers there, but one of the downsides of medicine is we're very slow to adapt. Like all this AI technology that I think is ready now, we're hardly leveraging any of it.
Are physicians very rigid and traditional with their practice?
I'd say I'm generalizing a ton, but what I've noticed is clinicians my age or older are very reluctant to change. And so like even like I said, from an AI perspective, some docs, what I see more adapted is the scribe technology, like to be able to take notes.
I've seen a lot of things about that.
But everything else, I feel like, even applying AI in their regular lives, I very rarely find docs that are optimizing their life using AI.
Yeah. No, I think those are great solutions, and those are definitely some resources and elements that maybe we'll see going forward. So this has been great. So we have one last quick segment before we let you go. You've been very gracious with your time. So this new segment was kind of inspired by, the Diary of a CEO podcast?
Oh, yeah.
Stephen Bartlett.
Yeah.
yeah, so we kind of got inspired through that, and it's where the previous guests on our podcast will ask the next guest, not knowing who it is, of course, a question. So you have a message here and a question from Tony Greco.
From Tony Greco in the house. Shout out to TG. He didn't know it was going to be me, right?
Nope.
Wow. Do you know who you are and what you want? Do I know who I am? It's deep. I'll start with what I want. I know what I want. And what I want is freedom. I want freedom to be creative, to utilize my talents to the best of its capacity. I'm a guy that loves thinking outside the box, solving problems. At the same time, doing it with people that have similar passion to try and create change and make this world a better place. That's what I want. Is freedom. Do I know who I am? Yeah. I know who I am. I'm a guy that is trying to create more joy in this world. That is naturally, my baseline is joyous, trying to create that existence for myself and people around me, but sometimes you get lost in it because of the nature of your job.
Really wanting that freedom. Where does that stem from?
You're good at this. This might seem crazy, but being in this field and my experience during the pandemic, you realize that a lot of people don't, like, if you are like unconventional, if you are approaching things differently, like, for example, writing books, doing podcasts, doing social media, that makes a lot of people uncomfortable. And what I've noted is that when you put yourself out there, a lot of people want to see you fail and will put a lot of effort into seeing you fail. And I mean, I didn't get into it today, but the journey to get here has been rewarding but exhausting. And especially being a Black physician, leader, there's always a lens on you, there's always eyes on you, and it's hard because you want to just show up as your authentic self, but you always have that voice in your back of your head, be careful, they're watching. And I've had multiple attempts to have parts of our existence canceled, like threats to the job. During COVID, we had threats to our family. We've had all these.
To your family?
Yeah, it was
wow.
When we were advocating for schools to stay open locally. Yeah, we would have some threats, unfortunately.
Wow, like, that's home. Like, that's like, that's a different level of hate that was thrown at you. Wow, I really sympathize for that. Wow.
Yeah. So I think to answer your question, the freedom is, I think, in this job you have freedom in a lot of ways, because you could be a researcher, you could go into fields that are of interest, but when you're unconventional or you're a bit different, there could be a lot of forces going against you.
Yeah, no, wow. I didn't know that. That's really fascinating. I think what you're doing is great, though, because you know what? Like, you're paving the way for the next generation of physicians, Black physicians as well, probably really look up to you. And, they're coming up the system for them will probably be a lot easier because of some of the things you have done, and I really admire that.
Appreciate that. I'm going to do one quick shout out. We have a Black Med Collective. It's our mentorship program that exactly doing as you described, trying to inspire some of our Black youth locally. And this year, I think we got 6 kids into medical school.
Oh, wow.
And one of them got over $100,000 in grant.
That's amazing.
So it's or in scholarship money, I should say. So
And where can our audience go check that out?
if you go to blackmedcollective.com or .ca, one of the two, or just Google Black Med Collective. We're also on IG. But yeah, that's one of the endeavors we're really proud of.
Yeah. Oh, I think that's amazing what you're doing there. Dr. K, this has been a pleasure. I really appreciate this.
Thanks.